Well, hello there and welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from the Aga Khan University Hospital. Now, did you know that the heart is the size of your fist and it is one of the strongest muscles in the body, and it started beating when you were about 3 weeks after you were conceived. And if you live up to 70 years of age, then it will have beaten 2.5 billion times. That tells you how important the muscle is, but that also says that it is prone to many diseases or conditions. And in this case, right here on Health Diary today, we'll be talking about cardiac arrest. So what exactly is it and who is at risk of the same? We'll find out after this fact of the matter.
Cardiac arrest is a medical emergency that occurs when the heart suddenly and unexpectedly stops pumping, causing blood to stop flowing to the brain and other vital organs. The main symptom is loss of consciousness and unresponsiveness, which can come on suddenly or in the wake of other symptoms. Cardiac arrest is often fatal if appropriate steps are not taken immediately.
All right, now according to statistics, they're saying 85% of cardiovascular deaths are due to heart attack and stroke. So today we want to understand more about cardiac arrest. And is there a difference between cardiac arrest and a heart attack? So Dr. is here to give us all that information. And Dr. Leonard Mzee Ngunga is a consultant interventional cardiologist from Aga Khan University Hospital today. Dr. thank you so much for your time. And we'll also have John Njuguna Kahiro as well to give us his journey. His story as far as cardiac arrest is concerned. But Dr. very quickly, getting to the basics, cardiac arrest, what are we looking at?
Cardiac arrest is a medical term, which basically means the heart has stopped. To the outsider or to the lay person, what does that mean? Basically, when a person gets a cardiac arrest, they collapse. They usually, if someone was standing, they fall down and they don't talk and they look like they are gone. So, in our term, it means the heart has stopped for whatever reason. There are a couple of things that can cause cardiac arrest. Right. And in our hospital, we are able to recognize them relatively easily. But outside there, it may be difficult to recognize it because when someone collapses, there's a tendency of people to panic. And one of the things we are really trying to do is to reduce that element of panic, because once people know someone has collapsed, it's a serious thing. The next thing you should go is to go and tap on the person, ask them, hello, are you okay? If they talk back to you, it is very unlikely the cause of the fall is a cardiac arrest because they are still talking, they can hear you. But if they're not responsive, we find they're not responsive, then the next thing is to try and feel a pulse, see if they have a pulse. Because sometimes they can fall down, they're not breathing, but there's a pulse. If there's a pulse, it means they may have fallen because of something else. But if there's no pulse, it's a very, very serious thing. And this is the time when we recommend you call an ambulance. The recommended procedure is to call an ambulance, or usually the person who wants to assist that person should not be the one calling an ambulance. Okay. So you should beckon your colleague or anybody else who is listening, oh, hey, please assist, call an ambulance. Yeah. Then you who has noticed that the person is not breathing, there is no pulse, then you do something called CPR. CPR means hands-only CPR. Okay. So what has been demonstrated is that outside the hospital, what is called out-of-hospital cardiac arrest, what helps people most is not the very complex devices that come from the hospital, but it's called hands-only CPR. That means you push on the chest as hard as you can, approximately twice every second. That means approximately you're able to give that person like a heartbeat of 100 to 120 beats per minute. Okay. By doing so, just the matter of pushing, you're able to cause what we call a chest recoil. You move the chest in and out, and the blood is actually able to perfuse the brain, which is a critical organ.
And I'm just curious to understand how people are aware, because it's very easy to confuse that with someone who has fainted. But you're saying if there's no pulse, then that could mean that this is all right. Okay. So then what is the difference between a cardiac arrest and a heart attack?
Very good question. So sometimes people confuse the two terms. Okay. So cardiac arrest, I've said the heart has stopped, and the heart has stopped because of a myriad of reasons, which can range from a heart attack to sometimes large clots forming in the heart, or indeed an abnormal heart rhythm. okay, which can, when the heart is not able to perfuse the body, the patient just collapses.
Right.
And once the collapse is usually a very serious thing, because within a few minutes, usually 3 to 5 minutes, if nothing is done, that person will have died. On the other hand, a heart attack means people get usually a chest pain or chest tightness, they start sweating, and there's a lot of opportunity to do something. So usually when people get that chest pressure, tightness, you feel really bad. Then that can be like a heart attack. So when you come to the hospital, we're able to diagnose it. So a heart attack is a sequence of events. When a heart attack is large, or when it affects a large part of the heart,
Okay.
or when it affects people whose hearts are already weak and diseased, then the patient can progress to cardiac arrest. So a heart attack can actually cause a
Oh, yeah, because I was about
cardiac
to ask,
arrest.
does one lead to the other?
Yes.
But, okay.
So a large heart attack can actually cause someone to have a cardiac arrest, and the treatment is the same.
All right. And let's speak to John. So 2018 is when you were diagnosed with cardiac arrest, right? What is it that you remember about that day? Because what I know is you had come to the hospital for something else, right? So, yeah, can you take us back to that day?
Only what I can recall is that I spent the whole night here, being attended. But in the early morning, I have to go home and look some sort of assistance from home.
Okay.
When I came, I went direct to the clinic. And during the clinic, after being attended in the clinic, when I was going to reception, that time I felt I never remember anything until the 8 hours.
Yeah.
That's only what I can say.
That's what you can remember. So what is that you came to the hospital for?
Well, I had some sort of less breathing. I could not breathe properly. I had some sort of the pain in the chest. So it was a combination. Mostly was the breathing. Because I remember that night, I was having a lot of problem through breathing. So I was assisted. I was given some sort of medicine for the assistance until the morning. That's only what I can say.
Okay. All right. And Dr. do you want to just pick up on what he said? So difficulty in breathing. Talked a little bit about chest pains as well. Are these like classic symptoms of heart attack, if we could say, or cardiac arrest?
So John's example is a very good example of how heart disease can eventually cause cardiac arrest, because he came with, he could not breathe.
Okay.
And he was just trying to get help. And he also had chest pain. And when he came to the hospital, he basically, why he could not go home is because he was really feeling bad, and he really wanted help. So when he came to the clinic, his heart developed an abnormal heart rhythm called ventricular fibrillation.
Okay.
So when people get a cardiac arrest, as I mentioned, sometimes it's a heart rhythm problem. And one of that heart rhythm problem is something called ventricular fibrillation. So he was actually sitting there waiting to be attended. And during the process, he just passed out. He did not remember anything. So luckily, he collapsed in the right place because the team was there.
Yeah.
And they brought in, they started CPR immediately. When John fell, it probably didn't take more than 30 seconds before we started CPR on him. Because I remember the first person who saw him was someone at the reception. He called the doctor, was in the clinic, and within 30 seconds, we are doing CPR. Within that time, we called somebody to bring the resuscitation kit. Okay. And he attached a defibrillator on John. While the defibrillator was attached, we found something called ventricular fibrillation.
All right.
And when you get ventricular fibrillation, the heart is basically quivering. There is no blood coming out of the heart. So the heart is not pumping, it's just quivering, and there's no cardiac output. There's no blood going to the brain, and that's why you collapse. Okay. So when we found that ventricular fibrillation, we were able to deliver something called shock. We shocked his heart, and interestingly, it changed from fibrillation to normal heartbeats.
Okay.
So within like a span of a split second, we were able to move from fibrillation to a normal heartbeat. And when the heart started beating, John was actually able to regain consciousness. Okay. We saw it there in the unit. He regained consciousness. He was still a bit confused, but he regained consciousness.
I mean, I can only imagine. You wake up and you find a lot of people in all these machines before you're trying to understand, wait, what happened? Okay, so what you're saying is, because some of these classic symptoms, are they like distinct symptoms that we all should be on the lookout for? Because again, some cases of cardiac arrest can be sudden, right? There are no symptoms to look out for. So what are some of these things that we should be on the lookout for?
So the cardinal symptoms of something not okay is you feel chest pain that is nagging and not going away. Sharpness, usually sharp,
very sharp pain.
Feels like pressure, tightness. Sometimes you feel sweaty. You feel it's like a dooming kind of sensation, so to speak.
Okay.
Another one is feeling dizzy. You feel like you are going to pass out.
Yeah.
That's not a good feeling. You feel like you're going to pass out. Something could be happening. So that feeling like you're going to pass out is telling you. So if you feel that, you are advised to sit down because it prevents the sudden fall. You sit down and if possible lie down if you are in a safe place.
Okay.
But if you fall from a sitting position, the fall is relatively not as dangerous. Another thing that you can do is to inform somebody. Okay, somebody who is near you.
Yeah.
You inform them, I don't feel very well, I feel dizzy. Even then, if something happens, then they can know, he just told me not feeling dizzy. So it means something is happening and something can be done quickly.
Okay.
So those are the kind of the warning signs telling you that things are not okay.
So very quickly, I'm going to go to you, John. So at some point, you were feeling some of these symptoms. You would go to a hospital, like we were discussing earlier on, and they said you were given some medication to help you with the same. And that was it until you had a case of cardiac arrest. So would you remember when you woke up and you saw Daktari, or not Daktari, the people around you, what was the first thing that came to your mind?
In fact, I was so shocked because I had a nice sleep.
Okay.
That's the thing. So when I came, I wake up and find the people are pumping me lying on me. I was still asking, why are you killing me? It's only one person who said, no, we are not killing you, we are assisting you.
Yeah.
But after waking, I had a lot of pain. That's what I can say. Though within the course of that week, I had no sleep. I was not sleeping at all.
Okay.
I could spend on 30 minutes and the whole night I could spend without sleeping. Because when I sleep a little, I become breathless. So I use most of the times during the night. I was sleeping about 20-30 minutes until the morning.
Okay. All right. So difficulty in sleeping, I'm pretty sure you... So when you were told that, listen, you had cardiac arrest, what was the first thing that came to your mind?
Well, I came up with a lot of people trying to explain to me how it was happening because, it was almost 1 hour since I regained my understand consciousness. So they were telling me that how it happened and how it was going on. But initially I was shocked because I never thought that could happen to me. That's all.
Yeah. And before then, so what state would you say you were? Like, would you consider yourselves healthy? Would you consider maybe, you were sick at some point, or what exactly happened? I'll come back to you, Dr. to help us understand that, because I'm sure there's someone who's watching us and thinking, so who is at risk of cardiac arrest? Is it just anyone? Is it someone who has, a pre-existing condition? But what would you say before the diagnosis?
Well, after that, I was so happy because there's no time. I was sleeping as usual, like a small kid.
Yeah. And before that, before your cardiac arrest?
I had a very terrible life, I may say. In fact, within 1 week, I had a lot of problems sleeping. I could not even. But after the honest season of being attended, I could sleep nicely. I had no issues at all. And even there was some sort of, I feel a lot of gas inside my stomach. I couldn't even, sleeping was an issue. So after that, I could not feel it any longer.
Yeah, okay. Dr. Let's go back to a diagnosis as far as cardiac arrest is concerned. So who is at risk? Does it just get anybody, or is it, who is at risk?
Worldwide, and Kenya included, the commonest cause of cardiac arrest is actually heart disease.
Okay.
More than 50% of people who get cardiac arrest, it is commonly related to heart attacks. So heart attack is by far the commonest cause of cardiac arrest. The second common one is what we call heart muscle disease. So it means apart from the heart attack means an artery has been blocked and the heart is suddenly unwell. On the other hand, you may have people who are what we call heart muscle disease. That means the heart is weak, it's not working very well, and the heart is straining. And that's the second largest group of people who are prone to cardiac arrest.
Okay.
So number one is people who have what we call ischemic or coronary disease, what we call ischemic cardiomyopathy, 50%. The next largest group is a group who have heart muscle disease. Another group now comes in, which are people who have heart rhythm problems, all right? Rarely, cardiac arrest is caused by other problems such as a large artery in the body, for example, tearing like the aorta. So people who have what I call aortic aneurysm, in the rupture, suddenly those people will bleed and their heart will no longer pump. Another one is blood clots. So you have heard of people developing blood clots which go and block the heart. Those are also notorious for causing cardiac arrest.
Okay. John, any of this sound familiar? Have you been diagnosed with any of what the current mentioned?
They were coming to me like some sort of feelings. Like when I say that the breath is unable to breathe and also sleeping nice. And that's what I do in that part of it.
So you'd say more of like heart attack.
So for John, for example, he came to the hospital because he could not breathe, as he's clearly saying. And once he got his cardiac arrest and we got his heart rhythm to normal, the next step was to take him to a cath lab where we went to determine whether indeed he has what we call coronary disease or acute heart attack causing the cardiac arrest. What did we find? We found that his heart arteries were actually normal; they were not blocked. However, his heart was very big. He has a heart muscle disease, what we call cardiomyopathy. So once we found he had cardiomyopathy, we put him on treatment. And he felt much better. He told he could not sleep. Now he could sleep. Before he went home, we put a special device called a defibrillator, which he has lived with for more than 5 years. And that device is called a Watchman device. Because once the heart is weak, there's a high tendency, or you are prone to developing those abnormal heart rhythms. And John has that device which basically sits in there and watches his heart.
Is it a pacemaker, like, Lehman?
It's a special pacemaker, correct.
Oh, special.
Yes.
Okay.
That special pacemaker that John lives with is actually a very useful tool. Over the last 5 years, has it given him problems? The answer is no. However, he has done very well with medication. So since he came in, we put him on drugs. John is back to work. He's able to do many things.
Absolutely. And that, again, gets me to my question that, I was to ask before we went on a break, and that is, in a case of cardiac arrest, an intervention should be made immediate. So how immediate is immediate?
So immediate is, so once blood supply stops, and by the time patients are falling down, it means already something has happened. It means basically you've had like 1 or 2 minutes when there's no blood supply to the brain, because the brain is one which keeps the body intact. The heart is just a pump. So it means the patient collapses. You have to start CPR within 1 or 2 minutes.
All right. And John, again, like he said, so you're put on medication. Do you have a special pacemaker, the one that Dr. says on? How are you doing? How is, what is your journey like with medication? What are some of the changes that you've had to make just to make sure that you're okay? You're able to sleep well.
I'm able to sleep well.
Yeah.
I'm able to continue with my routine.
Yeah.
And I may say, I've never seen something which can amaze me now. Because in case of any issue, I just press the doctor. I call him for any advice. Yeah. Sometimes it rings inside me. Yeah. So I have to call what is ringing inside. Because
okay. Yeah. And when does he say?
He just come. When I come, he told me, okay, it's because of this and because of this. And then he knew that we come back now. Yeah. So it's like what I said, it's a watch. In fact, it's a watch.
It really is a watch.
It's a watch. Okay. That's what I've said.
So you're taking your medication. But then again, so what is the biggest challenge? You were talking about this earlier on, and you said sometimes the medication can be very
challenges can be on the medication. That's one. And I may say, apart from medication, that's nothing else. Because you have to live with the medicine.
Yeah.
You have to live with the medicine.
Right. How many tablets? We're talking about 6 tablets you're taking in a day? You spend like 50,000 shillings a month. Yeah.
And I'm taking every night.
Yeah. I can only imagine how much of a burden that is. And I'm going to take this as your parting shot. So having gone through, this process, you are here today to share your journey with other people and tell people, listen, it is possible to still live a near normal life, just like any other person once you get the intervention. So what is it that you want to tell the people and the government, and especially after the cost of medication?
Well, first of all, I would like to thank Aga Khan University. Because, in fact, they did a lot of assistance to me during that time. And most of whatever or even the medication, and even also the machine itself, I think we cost share together.
Okay.
That one I'm thankful. And also I say, all is not bad, because if you realize that you are in this trauma or you are in these problems, if you can attend the clinic to the right doctor, they can be able to assist you.
And Dr. There's so much to cover, but unfortunately we have to end the conversation. So when it comes to like treatment, very quickly, in some cases, some might need a pacemaker, but is this always the end result, or are there other like treatment options that are available depending on maybe on the severity?
So we've made a lot of progress in treating patients like John here. And indeed, a pacemaker is really a great invention. So because if, for example, John got an abnormal heart rhythm when he's in his house or going about his duties, because sometimes patients want peace of mind. No one wants to walk around knowing, oh, I can collapse somewhere. That pacemaker kind of gives you that peace of mind that if something happens, he'll get treatment. Maybe, of course, if he gets a treatment, he'll be like, oh, what has happened? He has to come back to the hospital.
Is that the warning, the ringing?
Yes.
That you said that once you that something is not right?
And then we adjust our medications and we make sure he gets going. Okay. So if patients do well like John, it's a good thing because it means medication is sufficient. Occasionally, they don't do as well as this, so we have to upgrade the kind of, for example, pacemaker they have into more complex pacemakers. And indeed even more complex medications. So it is true that we do have patients who may not do so well with medication, but the majority of our patients do very well with medications.
So what is it that we can do to prevent? Very quickly, because we need to end the conversation. And also you want to speak a little bit on the cost of treatment and what can be done to sort of like subsidize the same.
You mentioned two things. As I said, cardiac arrest is caused primarily by heart disease, and the commonest of them is what we call coronary artery disease, which is caused by cholesterol problem, which blocks the heart arteries, and then clots form, and then people develop heart attacks. Whereas the second commonest cause is what we call heart muscle disease, caused by other diseases. And again, the commonest cause of this is hypertension. Hypertension is a very common cause of weak hearts. So by preventing heart attacks, by treating hypertension very well and treating diabetes very well, then indeed we can reduce the scenarios where people will develop all these diseases.
Yeah. All right. I see that. Do you want to speak a little bit on the cost?
The cost of the devices and the treatment. Yes, they are indeed they're high because an ICD is an expensive device. This special pacemaker is called internal cardioverter defibrillator. It's an expensive device. And it lasts approximately 10 years. And when the battery depletes, the patient has to come back for the battery to be replaced.
And that means you have to remove it?
Yes, again, you have patient that has to pay more money. So really, and you can't imagine you have a device which is protecting you, and now you have to stay without. It means really you are exposed. So that's what makes the device expensive. On the other hand, the medication which have to be taken every day, again, they are not one drug, but a multitude of drugs which are all geared towards improving the heart function. It really makes the cost, any medication which is taken over the long term, it is by default expensive.
Yeah, all right. But covered by insurance?
Many insurances cover these medications to a large extent, including our NHIF, our national insurance. The NHIF also covers these devices.
I mean, look at him. He's all smiley and okay. All right, but the biggest prevention we can all agree is, I mean, the biggest contributor towards saving cost is prevention. Like at all levels that you've talked about. Allow us to say goodbye right now. Unfortunately, we have run out of time. But this is a very important conversation that we have, or we needed to have. And a special thanks to Dr. Leonard Mzee Ngunga, who's a consultant interventional cardiologist right here at Aga Khan University Hospital, as well as Mr. John Njuguna Kahiro for agreeing to speak with us today. Asante sana for your time as well. And time now for you to take a look at this health tip.
I'm going to show you how to tone your biceps. Bicep, this muscle here. What we are going to do is called the barbell curl. Hold it this way, bend your knees slightly, put your chest out, and then you take it slowly from down, up towards your chest, then back down, up, and make sure it's only the arms that moves. You go for many repetitions. That will help you burn the fats. The lighter weight is the one you can use for many repetitions. We also have biceps with the dumbbells. Dumbbells are these ones. This is the move. Take it this way. It's like you're doing forearm, then you turn. That one will go for the biceps. All right? Same to this side. So you can alternate it. You can alternate it. And remember the counts. Many repetitions will help you burn and tone more.
Well, that marks the end of our conversation today as far as understanding cardiac arrest is. And now I know you know the difference between cardiac arrest and a heart attack. But if you still have more questions, our social media handles are down at the bottom of your screen. Use them and let's keep the conversation going. My name is Winnie Lubembe. A special thanks to the Aga Khan University Hospital for hosting us today. Until next time, adios. Did you know that your heart is the size of your feet? Fists. Feet. My name is Winnie Lubembe on behalf of